Alright guys, my name is Ashley and my presentation is on acute kidney failure, or also known as acute kidney injury. So, first, the pathophys of acute kidney injury, it's basically a rapid decline in kidney function from hours to days. It can lead to retention of waste, fluids, and electrolyte imbalances, but it could be reversible if it is caught early. When this occurs, there is a decrease in blood flow leading to a decrease in GFR, which then causes fluid retention, electrolyte imbalances, acid-base imbalances, and can result in metabolic acidosis, uremia, hyperkalemia, and then an accumulation of waste products such as creatinine and an increase in BUN. So the transmission and causes, first of all, there are three modes of causes of kidney injury, which are pre-renal, intrarenal, and post-renal. So starting off with pre-renal, some causes could be hypovolemia, shock, or heart failure. For intrarenal, some causes can be nephrotoxic drugs, acute glomerulonephritis, prolonged ischemia. For post-renal causes, it could be kidney stones, tumors, or an enlarged prostate. Now, for modes of transmission, it's not contagious at all. So it's usually caused by other medical conditions, trauma, or medications. So it won't really be transmitted. Now, the three nursing diagnoses that I came up with for this disease would be at risk for excess fluid volume related to decreased kidney function, at risk for electrolyte imbalance as related to use of nephrotoxic medications, and at risk for imbalanced nutrition as related to increased metabolic demands. So, the interventions for each nursing diagnosis would be, for excess fluid volume, it'd be important to monitor intake and outtake of liquids and monitor daily weights as well. Administering diuretics and restricting fluids as prescribed will just allow us to make sure the patient is not accumulating any extra fluids. Interventions for electrolyte imbalances would be to monitor electrolytes such as potassium, sodium, and in labs such as BUN and creatinine. This allows us to make sure that everything is working great. And then, as we all know, electrolyte imbalances could lead to cardiac dysrhythmias, so it is very important to monitor the heart. Now, lastly, interventions for imbalanced nutrition. It is really important to consult with a dietitian for a renal-friendly diet. Also, a diet limited in protein, potassium, and sodium, and more of a small and frequent meals. And then, as mentioned before, monitoring labs like albumin and electrolytes is very important. So now, the treatment plan. So, for acute kidney injury, it is important to address the underlying causes. For example, is it an infection? Is it caused by dehydration? After figuring out the underlying cause, it is important to manage everything else, such as fluids, IVF, and diuretics. Then administer meds, the diuretics, the potassium binders, the bicarbonate. And then, if needed, the patient will be needed to be sent to dialysis. And then, as we mentioned before, talk to the nutritionist to educate further on the proper diet and the proper way of eating. So, the impact. Nurses are often the first to identify signs of acute kidney injury, which, as we mentioned before, was decreased urine output, fluid overload, or lab abnormalities. And detecting these abnormalities as soon as possible can help prevent worsening of the renal function. So, continuous assessment of weights, vital signs, intake and output, and labs, as we mentioned before, are important for the treatment plan. And then nurses educate patients on avoiding nephrotoxic substances and managing comorbidities such as diabetes or hypertension, and adhering to the dietary or fluid restrictions that they are placed on. So it's very important for the patient to understand the way they have to eat, or understand how nephrotoxic substances can cause them or worsening of their acute kidney injury. And then nurses can collaborate with the interdisciplinary teams, such as physicians, dietitians, and nephrologists, to ensure comprehensive care and timely interventions. Now, the questions that I have for you guys. Let's start off with 1. How does the interplay between reduced renal perfusion, nephrotoxic agents, and systemic inflammatory responses contribute to the progression of acute kidney injury in critically ill patients? And what nursing interventions can interrupt this pathophysiological cascade? Question 2. In patients with pre-existing chronic kidney disease, how does the onset of acute kidney failure alter the diagnostic approach, treatment strategy, and prognosis, particularly regarding fluid management and dialysis initiation thresholds? I hope to hear from you guys soon. These are my resources, and thank you so much for listening.